Hello, welcome back to the Alle series presented by Travanci Aesthetic Talks. And today we're going to be going over the JuvéDerm family and how hyaluronic acid plays a major role in these dermal fillers. We're going to be going in depth about the ViaCross technology specifically designed for the JuvéDerm collection, as well as intricately defining each filler, whether it's Voluma, Volure, Volbella, Volux, or Ultra. We'll talk about each one and what the specific targeted area is per filler. We're going to start it off with the ViaCross technology, specifically designed by Allergan Aesthetics for its use in the JuvéDerm collection. ViaCross technology cross-links hydrogen molecules to create a smooth and efficiently cross-linked filler. All ViaCross fillers contain a small quantity of lidocaine to decrease the injection site pain. As we like to acknowledge, the authenticity behind these decisions and whether you would commit to a dermal filler is authentic to you. So we're going to be talking about this in a way as if you are the patient. So, to preface for your procedure, we highly suggest that a week before, you stay off the blood thinners, the vitamin E, and the fish oils. It is best to eat a lot of pineapple because it does help with bruising prior to the procedure. In terms of bruising post-procedure, post-consultation, Arnicare cream is very helpful for this. The most important thing to acknowledge with the JuvéDerm collection is that these fillers are reversible. You can inject a dissolvable, so if you want to reverse the injection, it's easy to take out the filler on the post-run. One of my favorite variables will always be patient assessment, as it pertains to which specific provider you're choosing. The reason why patient assessment is important with the JuvéDerm family is similar to the case of Kybella, in which the positioning of the cannula is important because of the vessels and nerves we have in our face. As you can see on each package of the dermal filler, it is labeled to have lidocaine. Lidocaine is a medicine that prevents pain by blocking the signals at the nerve endings in the skin. It's now easier to conclude why a plan of attack is so important for these procedures, because post-consultation, post-procedure, you will be experiencing things like a slight amount of edema after the procedure. Now, what does edema mean? It is simply swelling caused by too much fluid trapped in the body's tissue. Again, swelling isn't always a bad thing. After you turn 30, each year after 30, you're losing about 1% less of the collagen production. With that being said, letting the inflammation be, letting the swelling be, it's always best to let the dermal filler, the lidocaine, and the hyaluronic acid do its work. Through the entire process, Allergan Aesthetics specifically designed it to treat a various amount of areas along the face, providing some versatility for your provider. With that being said, let's go deep into each specific filler. So we're going to start it off with JuvéDerm Volux, addressing a severe loss of jawline definition. Again, we go over the nervature of the jawline with the masseter muscles and the masseter nerves. It is important that your provider is carefully assessing how your face and any asymmetry that is needed to be addressed. Again, why the JuvéDerm collection is so effective is because the hyaluronic acid with the gel helps it stay where it wants to stay. So, as we're talking about the jawline, those jowls, this is an important feature to ensuring its effectiveness. For the JuvéDerm Voluma injectable gel, a deep injection in the cheek area, helping improve the chin region, the chin profile, for anyone facing any age-related volume loss. In this circumstance, injections are transcutaneous, and in the provider sense, it is easier to use a cannula. It is highly suggested not to use under the eye or on the lip in terms of voluma. And now for JuvéDerm Volure. Injection into the facial tissue for the correction of moderate to severe facial wrinkles and folds. Because the product is using ViaCross technology, there's not as much swelling because it isn't pulling as much water. Effectiveness of this product being up to 18 months, this is highly suggested among the higher age groups. Feeling less volume on their smile, feeling like the smile lines are not as soft. JuvéDerm Ultra, in which we're addressing the perioral area for lip augmentation in adults over 21. The Viacross technology again helps this procedure be more cohesive, higher G prime, more water, the ability for the product to go back into its original shape. Again, these products are reversible because there is a reversible solution to the gel and hyaluronic acid. And now for JuvéDerm Volbella, also addressing lip augmentation and correction of perioral lines, as well as targeting the under eye hollows. If you feel like there are any superficial lines, you are able to enhance the natural look under your eyes. Rarely restores lost volume to the under eye hollows to create a smooth transition from the under eye area to the cheek area, with results that last up to 1 year. If someone wants something more full than a Volbella, a provider may suggest Volift, which is also another product lasting 9 to 12 months. Getting something more full, needing structural work. Again, the volume of patient assessment with these dermal fillers will always be important because depending on how much fat you do have on your facial area will determine the plan of attack along with the dosage of preferred areas to address. Finding the ideal doctor for this procedure will always seek the most volume based on the caution of being aware of the vessels and nerves in our face. I'm glad you are now fully informed on the benefits of hyaluronic acid and how this JuvéDerm family can address any little intricacies you see in the mirror. Whether you're using Volux to address the jawline, Voluma to address the cheek, Volure to address facial wrinkles, Ultra to address lip augmentation, or Volbella to address under eye hollows. This series of dermal fillers in the family of JuvéDerm will always be a great option and highly suggested from your provider based on the experience of these fillers. Thank you again for following along the Alle series presented by Givenchy, and we bring to you the JuvéDerm family, based of hyaluronic acid.